The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Dr. Tom Roselle here. Welcome to Ageless Health with yours truly. We just got done with a lively discussion, if you will, on WMAL 105.9 FM in the Mid-Atlantic, Washington, D.C. area. And we're going to continue that conversation. We're going to be talking about why you're so damn tired, chronic fatigue, if you will. Tired of being tired? Well, that's going to be the subject, if you will, of our next presentation at the Roselle Center for Healing in Fairfax, Virginia, coming up October the 22nd at 6 p.m. And we're going to walk through the weeds, if you will, and show you why, you're constantly out of energy. Your poop is gone. So we're going to continue the conversation. I mentioned a couple things to you a moment or two ago, and we're going to kind of run through that again here. But nevertheless, I want to remind you, make sure that you're following me on all your social media sites, from Facebook to Instagram, Rumble, you name it, we're there. And you can do it very simply. You can go to drtomroselle.com or scan the icon that's up there right now in front of you and make it happen. And you'll be able to get everything that we do on an ongoing basis, because I want to educate you, because you need to be the captain of your ship. You are the one that's in charge of your health. So let's get this tired of being tired thing and expand upon it a little bit. I think that you're going to find that a lot of your symptoms are not just fatigue, as we mentioned earlier. The symptoms of chronic fatigue vary, from obviously being tired all the time, not having the energy that you used to have. Sometimes things like depression. Sometimes there's a problem with headaches. Would you believe that, even they list the symptoms of alcohol intolerance? So, you shouldn't be drinking and to that extent anyway. But nevertheless, sometimes, I used to have a glass of wine with dinner occasionally, and now I can't even get 2-3 sips, and it makes me feel like my head's spinning and I don't feel good. And we go into all kinds of things, shortness of breath, and you can even have chest pain. You can have tremendous headaches. You can't do anything in the gym because you kind of fall apart. Your brain doesn't work in the way it's supposed to, cognitive problems and so forth. All that has to do with chronic fatigue syndrome. So we're going to pull that apart piece by piece over the next few weeks, leading into our in-house presentation on the 22nd at the Roselle Center in Fairfax. This last Wednesday evening, by the way, we had a great program. We were talking about thermographic imaging, and then we did some demonstrations. And those of you who were there, I think you learned a lot. And I had fun with you because, how I get carried away and start interjecting things that nobody knows about anyhow. So, but join us on the 22nd of October, and I promise you we're going to do much more of that, particularly in this situation. We're going to do a lot of demonstration. But chronic fatigue syndrome is something that used to be, in the medical community anyway, a bushel basket or umbrella that covered all kinds of things. But it comes down to very specific platforms. You really have to understand why it's taking place. If you understand the why, you can fix anything. If you don't understand the why, you can't fix anything that goes on in your life. So let's pick it apart a little bit more than what we did a while ago, and talk about these patterns. One of the things I want to talk about is something called inflammatory encephalitis. And what do I mean by that? So we can have inflammation of the brain, which begins to shut down all kinds of things, leading to this thing called chronic fatigue. People don't think about that. Where does that come from? Why would that happen? Well, there's a host of different conditions and situations and exposures that may bring that about. One, very simply, is that you eat like garbage, right? You're getting all the nonsense in your body, and you wonder why you don't feel good. It's like getting a car that needs 93 octane or better, and you're putting 87 octane in it. There's no poop to go. And same thing with you. That's the basic patterns. But let's talk a little bit about, this encephalomyelitis, if you will. And what got my attention on this has to do with the brain, and it has to do with the chronic fatigue pattern. They're hand in glove, according to this article that I read that came out of the Mayo Clinic. And they kind of have a cutting edge. Sometimes they don't have the answer how to fix it, but they begin to understand that there's issues. So causes of this extreme fatigue that lasts for more than 6 months. That's how they put it. That lasts for more than 6 months. So you have this myalgic, that means muscle weakness, encephalomyelitis, chronic fatigue syndrome. For those of you who like the alphabet, it's ME/CFS, and it's really, according to the Mayo Clinic, a very complicated situation. So here's their punch list. You have to have fatigue, extreme fatigue, that lasts more than 6 months. The symptoms worsen if you're physically exhausted or mentally exhausted, but you don't improve on rest. You go to bed, you sleep for a couple of days, and you still feel tired. Now, my brain starts going, okay, what's the fight-flight mechanism that's not communicating? What's that HPA axis, hypothalamus, pituitary, adrenal, that is not working the way it's supposed to? I'm going to tell you why that's important in just a few minutes. So, but the cause, according to Mayo Clinic, of this MECFS, this myalgic encephalomyelitis / chronic fatigue syndrome. I think the bigger the definition, the less that they know about it, but that's just me talking off the top of my head. There's no, according to them, there's no single test, if you will, that can confirm the diagnosis. You need to be a variety. You have to do a variety of tests, medical tests, to rule things out. And you have to eliminate other similar conditions. You know what that sounds like to me? It sounds a whole lot like fibromyalgia. You diagnose it by ruling out. Well, I'm here to tell you there's a way of diagnosing these things, but you have to walk through what the body actually does. And we're going to talk about that in a second. So the symptoms of this MECFS, if you will, can vary from person to person. Well, go figure, right? We're individualistic. Are there characteristics that are similar? Yes. But in addition to fatigue, there are things like exhaustion. And it's just not tired. You just kind of can't move. Physical or mental exhaustion. It's like your brain doesn't want to do any of the tasks anymore. Problems with memory or thinking. Now we're talking about old age stuff. I'm worried, right? Well, here's the deal. It can happen to any of us. You get dizziness. That dizziness worsens, if you will, from moving from a lying down to a sitting up or standing position. That's documentable. That's called adrenal fatigue. Why? Because you have an outer shell of the adrenal system that puts out a hormone, angiotensin, angio blood vessel tension tone, that puts a little squeeze in your arterial bed that stops the blood from dropping. So if you get up too fast, all of a sudden you get dizzy. You say, oh my God, where did that come from? That's what they're talking about. That's that postural hypotension is really what it's called. And then joint pain. And then again, we talked about just a minute ago that you go to sleep, but you still wake up totally exhausted. You can't seem to repair itself. A lot of people with this problem, they end up with a host of different symptoms, everything from headaches and sore throat and tender lymph nodes, and everybody's going, oh my God, I might have something that's worse. Well, this isn't so hot by itself, but they become super sensitive to all kinds of things. Like what? Like, just looking at the light. I'm going to tell you what that means in a second. Sound, smells, foods and medicines. They can't touch anything. Well, forget about the medicine part. Everybody should be sensitive to that anyway. But here's the deal. So if you're sensitive to light, you go outside and you go, oh my God, where are my sunglasses? And it's not because it's the glare, it's because it actually hurts your eyes. Or you maladapt from going to inside to outside or outside to inside, or nighttime when you're driving, you can't focus. That's an adrenal fight-flight reaction. So what's happening is your adrenal glands, these guys that do all kinds of things, the little pupil that you have in your eye, it controls its expansion and contraction. So if you go out in a bright light, what's supposed to happen is that pupil narrows down in the bright, intense light and stops you from going, ow, that hurts. And it's not working the way it's supposed to because your fight flight system isn't working the way it's supposed to be working. So when you start looking at these symptoms, according to the Mayo Clinic, of this MECFS, this myalgic encephalomyelitis / chronic fatigue syndrome, it still doesn't answer the question why it's there. They're just putting these things out there, which makes me absolutely crazy because there's a reason why things take place. And if you answer the question, the why behind it, now you can fix it. And, when we were here this last Wednesday evening at the Roselle Center for Healing and talking about thermographic imaging, and I got into diagnostics and finger pointing and so forth, I said, why thermography is so good is it can help answer the question where it's coming from. And then you start stacking, except for this random thing. But that's a different story for an ongoing conversation. But let's talk about this because it's really important. So when you're talking about a chronic fatigue pattern, any kind of chronic fatigue pattern, you have to make sure that you understand the mechanism that is taking place. If you don't understand the mechanism, you can't fix anything. So let's talk about the body's basic fundamental energy pack, right? So you've heard me talk about hypothalamus, pituitary, adrenal glands. So the hypothalamus and pituitary live in your brain. They're small little organ systems, but they have major control over all kinds of things. The next piece is those little glands that sit on top of your kidneys called the adrenal glands. And there's a communication going on, but I want to add another piece of the puzzle. It's your thyroid. Your thyroid sits right here in your neck, but it's directed by what? By your pituitary to work if everything is working properly. So your pituitary says, hey, thyroid, start kicking in. Produce something called thyroxine, which is T4. And then that T4 has to be converted in the liver to what? T3, which is the active hormone. So we all know that if your thyroid's not working the way it's supposed to, one of the primary symptoms of fatigue is what? I'm tired all the time. I have no capacity to do anything. I can't think. Do you see how all these symptoms overlap? The thing that is missed, in my opinion, most of the time, is that they don't follow backtrace all the way through to what could be the triggering mechanism for this fight-flight reaction. But let's just kind of stay the course right now and talk about chronic fatigue expression, if you will. As I said, you can have a headache, you can have chest pain, you can have sore throat, you can have fatigue, cognitive problems, and so forth, and they all stack. The answer lies in finding what is triggered it. So let's go back up a little bit and let's go to what may cause all of these bizarre symptoms. And over the next few weeks, we're going to get into a little bit more and a little deeper, and we're going to tell you what you have to look for and so forth. So make sure you stay with me on this because this is something that affects millions and millions and millions of people in the good old USA. So what are your triggers? Well, how about stress patterns? Remember, we always talk about structural, chemical, emotional platforms, no matter what they are. So excess of anything. You're eating garbage foods. You're constantly worrying about something. You're pushing yourself to the end. You don't sleep the way you should. You're putting up with chronic pain patterns. All of those things and more, or you're on medications, you're taking drugs of some sort because it makes you feel good. You're taking Benadryl or something to go to sleep at nighttime because it calms the nervous system down. But it starts stacking the need for it, one on top of the other. All of these things beat you up, so to speak, to use the vernacular. And when that occurs, your body can't repair, can't recuperate, can't move forward. And you wonder why you feel as bad as you are. So you start popping either drugs or vitamins. And so, you can use nutritional substances just like a drug, right? So you think it's good for you because they're natural products, but you can throw other things off as well. And that's why, when we put somebody on any kind of nutritional support, we're testing it neurologically through neuromuscle function response testing. And the body tells us whether this, may not be so good for you. But let's get back to the cause of this fatigue pattern, this adrenal wipeout, this tired of being tired syndrome. It's critical that you answer the question, why was something like this? Because if you don't answer the question, why, you can't fix anything. It's an impossibility. There's no way. You look at the patient, you start asking questions. Questions have to be about, has there been any prolonged injury pattern to the body that hasn't been resolved? You're just there, you're putting up with it, or you're taking Advil, or you're taking this. If it gets too bad, you take a little Excedrin, whatever it happens to be. If the answer is yes, how long has it been in place? Your body's pulling resources to protect you, allow you to put up with it. But in the meanwhile, you're crashing. You're going down the tubes faster and faster and faster. Next question is, what are you feeding your system? Sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products, things of that nature, right? Gluten products, ongoing, because they're so bad in this country. It causes a problem, causes an inflammatory reaction. What is your brain doing? Is it stinking thinking? Meaning, your body says yes to anything that you hold as true. If you think you can, and you will. If you think you can't, you won't even try. But more importantly, if you think you're in trouble and you have no energetics, or you think the world is falling, you remember Chicken Little? Same thing will affect your body. That's how it works. Absolutely 100%. So you have to put it all together. And then you look through what's dampening down the symptoms. What drugs are you taking on top of that? And then you wonder why that you can't wake up in the morning. It takes you forever to get going. Even if you have something exciting that you want to do, you can't do it. Why is that? Why can't you get yourself going? Now, could it be more pathological? Sure. In the world of post-COVID, we're seeing a lot of things that never have been there before. We're seeing hormone levels down around people's toenails. What will that do? Particularly testosterone. It's going to make you tired. Low testosterone, male or female, is going to make you feel horrible. So when did it happen? Could be after you had that first vaccine. Maybe it was after you had the booster. Maybe it was after you added other things to it. Think about it. Trace it yourself. Fortunately, we have found that there's other things that we can do to begin to reverse that process and support the patient's recovery process to get them back to where they used to be. Here's the deal. You have to take you where you're at. The question is, when did it first start? What happened over a period of time? We rule out, well, you're not anemic. The doctor goes, well, you don't have an iron deficiency anemic. You don't have a B12 problem. Hopefully they check that. Oh, your thyroid is working really well. You're within the normal parameters. But for you, that normal parameter may be off. You may have a fibromyalgic pattern. That means pain that hasn't gone away, all four quadrants of your body for 4 months. And there's a lot of other characteristics, but it's one of the overlying symptoms that goes hand in hand with chronic fatigue. So pain that is unremitted, high level or low level, that just doesn't go away. You're on all kinds of drugs, or you're taking social drugs, or you're drinking alcohol. You're a smoker, so you're not bringing in the oxygen that you need into your system. You're sitting around on your derriere all day long and looking at the stupid tube or flicking your phone or whatever it is that you do that is not active, and you wonder why you're tired. You look at your dinner and it's what? Catch as catch can. You're going to grab a hamburger, or you're going to get a Coke to keep you going, or you're going to get a candy bar or whatever it is, and you wonder why you're tired. The crash is inevitable, but what is it that you're doing? We talked about that pituitary gland in the middle of your head. It signals your thyroid. It also signals your fight-flight system, your adrenal system. It also signals your gonads. It tells your testicles to produce what? Testosterone. Ladies, it tells your hormonal function to balance estrogens, progesterones, and what? Testosterone. And so if that system, that communication is not working because as there was an injury, there's an inflammatory wall, there's a block, it can't get through it, nothing that you do, take, or try to correct in lifestyle may make a difference. So you have to make sure you understand where it's coming from. Now, let's get back to our friend the thyroid, because that's one of the most complicated pieces when it comes to adrenal fatigue, chronic fatigue syndrome, any kind of tired, I don't feel good situation. So when you look at a patient, you look at your friend, you look at your neighbor, I'll give you a diagnostic that you can pick up. Take a look at their eyebrows. If their eyebrows aren't full and come all the way down, the long piece, or it depends on the face, they come up, but they're full. That's a primary indicator that their thyroid is not working adequately. Let me tell you again, diagnostic characteristic, across the board, 100%. If the eyebrows are thin, one side or the other, and they're complaining about, I'm tired, I don't feel good, I can't think the way I should, even though that their thyroid test came back within the parameters, that is an indicator that they have hypothyroid something. And what is the symptom? Almost across the board, I'm tired, I can't motivate myself, I can't get it done. Or if you're putting up with chronic pain all the time, that pain pattern is draining to the system. Why is the pain there? Why are you on all the drugs? Why do you take this host of pharmacopoeia, if you will, that nobody else is taking or shouldn't be taking? Your body wasn't designed to take all these medications. Your life is not a drug deficiency when it's in a bad place. It's because nobody's finger pointing to the cause. So if you can find the cause, all of a sudden your energy comes up. You feel fantastic, better than you used to. I mean, anything's fantastic compared to feeling like nothing, right? So in October, on the 22nd, we're going to go over this in detail. And maybe for the first time, put a fix to your problem. Maybe for the first time. Wouldn't it be wonderful to be able to turn something around that you've been struggling with for a long time? Join us. It's going to be a great night. We're going to get into the weeds on this thing and show you what can be done to maybe finally get your life back. Those of you who've had long haul COVID patterns, that you're tired, you can't get enough sleep, or your sleep is interrupted, and you wonder why. Well, there is a why, and we're probably going to touch on that as well. But make sure you understand that most diagnostics, even this thing that we just talked about from the Mayo Clinic, this myalgic encephalomyelitis / chronic fatigue syndrome, right? This MECFS is a diagnosis based on symptom presentation and nothing more. It doesn't answer the question why something is taking place. You can say, yeah, it happens for this length of time, it happens for this length of time, but guess what? It doesn't tell you anything. And then, when you're talking about the diagnostics, they start checking in, they talk about sleep disorders, and they talk about, the fatigue patterns, and, they do touch on diabetes and anemia and underactive thyroid, but they haven't touched on that fight-flight system. They haven't touched on that adrenal system. They haven't touched on the why those things may not be working the way they should. See, to fix anything, you have to understand the why. Take a look. Is there injury that hasn't been corrected that you're putting up with, that you've modified? Do you have toxins that are going in your system on an ongoing basis, and you when you try to correct it, your brain goes into, well, a little bit's not going to bother me, except it accumulates over time? What exposures there? Do you live in an area like Northern Virginia, where how many hundreds of data centers are going in? Yeah, I said it. The data centers have electromagnetic pulses that affect how your body functions. Period. End of story. The data's out there. Look it up. But just don't go to one site. Go to multiple sites. Do you have mental health issues? Or you're getting into, this depression, anxiety because not because of life happens, but because that your biochemistry, your neurotransmitters, your microbiome is not working the way it's supposed to? Do you have ongoing headaches and tension and cloudiness? Did you know that could be a result of the upper vertebrae, the bones of your neck being out of place, causing compression, irritation, inflammatory reactions to the brain and to the spinal cord? It happens. It's called, in the chiropractic world, it's called a spinal subluxation. In the osteopathic world, it's called a spinal fixation. The point of it is, in either way, regardless of what you decide to call it, it's there and it's causing problems. But the diagnostic criteria for a chronic problem like this that ultimately leads to other things like an irritable bowel, a lot of pain patterns, and then, even the literature says it goes back and forth between fibromyalgia and fatigue, back and forth, back and forth. They don't know which one it is. They have to run the right tests, cortisol tests. They have to run the right tests. Look at thyroid function, look at pituitary function, look at cranial injury patterns, and be able to put it together in a succinct, understandable process. But here's the important part. Can they fix it without throwing a drug at you? Can they get you to change a few things, but also to balance your energetics in your body, do things that will manually get rid of the pain patterns? I don't know about you, but in my world, in my life, over a period of many years, I've pushed and I pushed and I pushed and I pushed. And there have been moments in time I've had to catch myself, knowing what I know, and say, hey, you got to do something about this. You got to slow it down. You got to stop. But when I do that, I have to look at, have I been truly resting? Have I been staying away from constant electromagnetic fluxes in my environment? Have I been gently exercising? Have I been eating the way that I'm supposed to? And then what am I putting up with that I shouldn't be putting up? But then I look at, and it all happens to everybody, it's like that short-term memory span, focus, concentration. If that starts slipping and I'm dizzy, if that starts slipping and I can't keep myself on track, there's something that I am missing. And sometimes the closer you get to it, the more you can't see what's really taking place, because I think I'm impervious. I think I can keep going. Well, I'm sure that many of you have had the same feelings. But we're going to talk about on the 22nd, we're going to talk about the why. We're going to show you how it connects neurologically, biochemically. We're going to put all those pieces together. Here's the deal. Register for that class now. Don't wait. Make it a plan. Don't put it off. Don't say, well, it's a month from now. Do this. Go to drtomroselle.com. Register. Go to rosellecare.com. ROSELLECARE.com. Or don't wait. If you go to rosellecare.com, you're going to look at the top of the website, and there's a spot up there that says, courtesy consultation, 20-minute consultation, free. Nope. No, you don't even have to come in. One of our doctors are going to pick up the phone. They're going to call you, and they're going to answer your questions. Wouldn't that be cool? You don't have any obligation. Just give them a call and ask for one of our guys to give you a call, and they'll talk to you about whatever concerns that you have. And they'll tell you straight up, is it a fit or it's not a fit? What can be done? Ask them any question that you want to. There's no charge to you. Why are we doing that? You should ask that question for anybody. Why would we do that? One is because you deserve the information, the right information, the true information, the honest information, not the ones that are being served up to promote anything. So you can make a decision based on where the actual data really is. So give us a call. You can call the office at 703-698-7117 and tell one of the staff members, hey, listen, I'd like to take advantage of that free 20-minute consultation. Is there anybody that I can talk to? And the doctors will call you. I promise you they will do that. Or attend the class on the 22nd, and we'll really get into the weeds with it. I'm going to be there, and we'll make it happen for you, okay? Call, register the old-fashioned way, get online at rosellecare.com or drtomroselle.com. Either way, register. The only thing that we ask from you is one thing, If you can't make it, let us know that you can't make it. Call about 24 hours before so we can save that seat for somebody else. But we'll have fun, I promise you that, as we always do. Thanks for joining me. We'll be back within a few days, a week maybe at the most, with another episode, and we're going to continue the process, and we're going to pick the symptoms apart. But remember, I do this because I want you to have the data, but more importantly, significantly, is I love you all. You have a great day. Bye.